sitting here, minding my own business. And then you come up.
Ma'am, did you hear my last question? I'm asking if you have any medical problems or issues that we can help you with right now.
It's just, my friend went to go and get me some food or something because I'm not feeling well. I have diabetes and I think I'm having a reaction.
Okay.
I hope she gets here.
Okay, so you have diabetes. I noticed that you have a medical alert bracelet. May I see it?
Okay?
With the individual's help, we ascertained that she had diabetes and was having a medical problem. We were able to obtain her name and necessary medical information from her medical alert bracelet.
The best route to take in these situations is to continue to ask questions in a calm voice, repeating them if necessary, since the person you are encountering may be in a confused state. Time is critical. With lower and lower blood sugars, the medical situation may get worse. Severe hypoglycemia can cause seizures or loss of consciousness. The course of action is 1. Attempt to determine if the person has diabetes. 2. If the person is conscious and not having a seizure, provide a quick-acting source of sugar, such as sugared soda. And 3. Get medical assistance if the situation does not improve or questions remain. The quickest way to raise blood sugar for someone experiencing hypoglycemia is with some form of sugar, such as half a cup of juice or sugared soda, or 5 to 6 pieces of hard candy. It's important to treat hypoglycemia quickly because hypoglycemia can get worse and the person could pass out. If this occurs, immediate treatment by medical personnel is needed to avoid brain damage or death.
Sarge, can you radio this in and have them send fire rescue?
Time 119. Can you send fire rescue to this location? Fire rescue is en route. I'm gonna walk across the street to the store to see if I can locate Miss Johnson.
Okay, ma'am, fire rescue's on their way.
Here comes my friend now.
After speaking with her very calmly, she realized that we were there to help her and that medical attention was on the way.
Please! My friend needs these. Thank you.
What these officers did was the absolute correct course to take in this case. They worked quickly with the individual to rule out if she was under the influence, helped her receive a quick-acting form of sugar at the closest location, and got medical assistance.
Police may encounter a person with diabetes in a number of situations, from a routine traffic stop to processing a person who has been arrested, as you'll see in this next scenario.
A male in his 30s was arrested for a summer offense on a Saturday evening. We brought him into the district to type up a citation, check for outstanding warrants, and to get a court date. When we arrested him, he informed us that he has diabetes and was wearing an insulin pump.
A person with diabetes needs to have with them a blood glucose meter to test their blood glucose level, any medications, such as insulin, and a way to treat hypoglycemia if it should occur.
Hey. All right. This guy has a medical alert bracelet on for diabetes.
Okay.
He also has an insulin pump on. He had a medical supply backpack on. I documented everything that was inside the bag and gave it to the operations room supervisor for safekeeping. Sir, you can have a seat right here in this chair.
Okay, good. I'll put him in cell number 4 after I go through Taney's medical checklist.
Okay.
Okay, Mr. Johnson, we need to go over this medical checklist with you while the officers are preparing your citation. Are you presently taking any medications besides insulin through your pump, of course?
No, just the insulin.
Is this the first time that you have been arrested?
Yes.
Besides diabetes, do you have any serious mental or medical problems?
No.
Do you have diabetes? That's a yes. Are you receiving any type of treatment other than through your pump?
No.
Is there anything else you should inform us of to ensure your well-being?
I don't think so.
Okay, you have diabetes and you wear an insulin pump. You need to keep the pump on you, but we'll hold on to your supplies for now. While the officers are typing up your citation and getting a court date, we'll run your record. If you don't have any outstanding warrants, you should be out of here in about an hour.
Part of keeping diabetes in control is checking blood glucose often. Normally, a person with diabetes who feels their blood sugar is too high or too low will check their own blood glucose level. This is done using a lancet to pierce the skin and then obtain a drop of blood, which is put on a strip into a meter, which then tells the person their current blood glucose level. It's vital that provisions be made so that the person with diabetes has access to blood glucose monitoring equipment and medications, even when they cannot remain in their own personal possession. Typically, a person with diabetes handles these tasks himself or herself, but in a arrest situation where that may not be feasible, the police need to ensure appropriate care. During a short detention like this one, there will probably not be a need for blood glucose monitoring or for medication. However, if the detainee requests medical care or exhibits symptoms of hypoglycemia or hyperglycemia, he or she must be promptly transported to the nearest hospital. In the case of detentions lasting more than an hour or two, the detainee with diabetes must be transferred to a police facility where there is someone who can provide blood glucose monitoring and administer medications.
Okay, Mr. Johnson, as far as your diabetes goes, how do you feel?
I guess I'm okay, but I think I might be coming down with the flu or something.
Okay, I'm going to have to place you in this cell for right now while we type up your citation. Are you sure you're okay?
Yeah, I'm fine.
An arrest for anyone is obviously a stressful and traumatic experience. It can easily have adverse effects on a person's personality and their physical well-being. For the person with diabetes, however, this stressful situation can lead to a much more serious event for several reasons. First, many people with diabetes have to take insulin multiple times a day, either by injection with a syringe or a pen, or by continually wearing an insulin pump. Others take oral medications, and some need both. But a person with diabetes who takes insulin or oral medications needs to continue taking these medications without interruption. The individual may or may not have these medications on their person at the time of the arrest. Medications are needed to keep blood glucose levels from being too high. In addition, people with diabetes need access to food to avoid blood glucose levels from becoming too low. This means regular food intake must be maintained, and a quick-acting source of sugar, such as sugared soda, juice, or hard candies, must be immediately available in the case of dangerously low blood glucose levels. Also, most people with diabetes have to test their blood glucose levels many times a day to determine if they are too high or too low, and to determine the correct amount of food and medication needed to keep blood glucose levels in the safe range. Finally, the stress of an arrest itself can cause blood glucose levels to become too high or too low. To deal with these issues, it is proper procedure to identify a person's medical condition upon arrival. It should be noted, if the person needs to take insulin and or medications to treat the disease, and what the person's food requirements are.
Officer? Hey, officer!
What happened?
I don't feel so good. I just threw up and I've been peeing a lot.
Okay. Hey, Sarge, the guy in 4, something may be going on with his diabetes. We need to get him to the hospital.
Yeah, I think so.